I'm Marianne Mason, Associate Professor of Emergency Medicine at Northwestern University and Principal Investigator for the statewide unintentional drug overdose reporting system in Illinois. I'd like to talk for a few minutes about opioid overdose deaths in Illinois during the time of COVID. Unfortunately, the news isn't good. There have been reported upticks in overdose deaths in Illinois, both in Cook County and in a number of other counties within the state. While we don't know for certain, we believe that these overdose death increases are due in part to self-isolation due to COVID-19, lack of access to naloxone during self-isolation, and also lack of access to drugs, which then reduce tolerance and put people at risk for overdose once they resume using drugs. The panelists today will talk about aspects of the drug overdose problem in specific Illinois counties and connect to resources for naloxone distribution.
So I want to introduce myself, Lisa Snow. I work for SUDORS with Lurie Children's Memorial Hospital, and I cover everything south of I-80 as a community outreach coordinator. And we've seen since COVID, of course, community outreach work becomes very difficult to do when everyone is locked down. And I started to talk to various coroners by phone and email and was hearing that cases were increasing with opioid overdoses. So we wanted to see if we could figure out another way to do some outreach while the COVID is still going on and people are still sheltering in place, especially the people that are high risk. So we came up with this idea to.
I think Peoria is kind of unique in the fact that I think what we represent may not be what is coming out of counties like Kane County or Winnebago or Lake, the larger counties up north. Offer with our data and what we're seeing down here is a really good sample size of what's happening up around us in bigger, larger counties. We're seeing a lot of methamphetamine mixed overdoses with our opioids. So it's not just methamphetamines, but we're also seeing an array of benzos mixed with those, heroin and cocaine, and then the mix of all those things together. Now, I have been in really good communication with the JOLT Foundation here in Peoria, which is our harm reduction foundation that has been really limited on the traffic that's coming in and out of their place to have their drugs tested for the fentanyl and their Narcan distribution, unfortunately. The good thing is their executive director and their outreach coordinator, Chris Scheffner, has been able to go out on the streets, meet with people, distribute Narcan, and things like that. The unfortunate thing is, like I said, the traffic coming in to get the medications tested with the fentanyl test strips has been significantly limited. The other thing that Chris and I have dialogued about, particularly here in Peoria, is the lack of access to treatment, which has always been an ongoing thing here in Peoria, is the limited resources and then space for people to get into treatment. And then on the side part of that is people who were maybe going to group therapy or involved in other cohesive therapy treatments. It's been nixed because of the social distancing, and the group meetings have just dissipated and they haven't been able to get into group. And then we take maybe a portion of those people who maybe have lost a job and now they have no job, no income, the stress of their bills, the stress of trying to maintain and take care of themselves and their families, and then they're relapsing and going back into using again. And then they don't have a partner to use with, they don't have access to Narcan. It's just been a cumulative snowball effect related to the COVID-19 pandemic, unfortunately. What's good about being in phase 4 are those things that have been limited or opened up. I know the traffic through the JOLT Foundation has increased, and they're able to spend more time with their clients on a one-on-one basis, because we all know, truthfully, the loss of human contact plays a huge role in your mental capacity and your mental stability, not having that one-on-one, hand-to-hand, hand-holding communication and contact with people plays a role in people using in their depression and their drug use. So they have had that contact reinstated again, which is really good. So their traffic's improved. Moving forward, I think here in Peoria, we're going to continue, and I say we, meaning the Jolt Foundation and the people that they have that surround them as volunteers. Also the Human Service Center here, we have a couple other Cody's Crusaders who are continuing to go out and do outreach and awareness. I think COVID has kind of taken away that outreach, unfortunately, and taken away, it's kind of removed the opioid crisis off everyone's radar. So I think getting it back up there, continuing the street outreach, continuing to let people know, hey, we're still having people die of overdoses, is what we're going to have to do.
We have some of the same problems pretty much that Jamie has there in Peoria County. We had a couple of things go on. We do have some outreach. Our local hospital, we were kind of a test site for a step down program, 3 to 5 days that they would offer 5 different people. They had 5 beds for this. And we found, well, this was before COVID, of course, but we found that we weren't getting the local people coming forward and wanting to detox. And it was just going to be an acute detox till they could get into a program. And so they shut that down. And I don't know if COVID had anything to do with that, but it ended up shutting down here just a couple months ago. So I'm not sure if they're going to reopen. I'm not really sure about that. We did have Champaign Public Health in Champaign County, which is our Vermilion County uses them a lot for stuff. They came over and did this prompt partnership to reduce opioid mortality and promote training. They came over and did a bunch of different site visits, and they distributed Narcan kits. So I don't know if it was a false sense of security that people were getting the kits thinking they would be able to administer them to themselves. But we had 24 drug overdoses last year. Now I'm in a county of 80,000 people, and 24 is the highest we've ever had that we've recorded, and that seemed to be a lot. 4 were intentional and 20 were accidental overdoses. So we're seeing the same thing with the stimulant mix on our radar. A lot of fentanyl. And a lot of polysubstance. So a lot of things, I mean, I've had a couple of straight up cocaine overdoses, and I've had some straight up methamphetamine. I even had a gabapentin overdose, and we're seeing that being in the mix too. That gabapentin seems to be making a difference, because I don't know if the synergistic effect, and Jamie may be able to speak on that more than I can, since I'm not, I come from law enforcement background, not a medical background. And I've only done a couple pharmacy classes, but I think that enhances the effect of the other drugs on board. So now they're mixing that. And I heard from a local pharmacist that Indiana was going to put that on controlled substances, the gabapentin. And I've had several that have had that in the mix. So, we're looking at that too, because that seems to be something that's emerging in our community. We've had prescription medication, hydrocodone, and those kind of types of, we've had fentanyl, we've had acetylfentanyl. So I think we've even had carfentanil come up in one case. So we've had, kind of the array of fentanyls show up. And I don't know if it's because Vermilion County, we're right on the border with Indiana. I-74 cuts right through our county, right through the middle of our county and the county seat here in Danville. And I don't know if that may be a drug trafficking route. I know 57 is usually considered the drug trafficking route in Illinois, but I don't know if that's why we're seeing all these different mixes of things. And that's kind of what we're seeing here. We do have a couple of places that do outreach, and I just think they've been inhibited with COVID. It makes it a little more difficult. But like Jamie said, it's everything opening back up. Hopefully things will start getting back to that. And we have, we had a lot of publicity towards the end of last year about opioids and opioid abuse. And then we haven't really had anything. Here we are into the first 6 months, going on 7 months of the year, kind of taken away from the focus.
So I am a community educator with UNITYPOINT Health, Unity Place, with a drug overdose prevention program grant. This drug overdose prevention program grant provides free substance use education, overdose awareness, prevention, and Narcan, also known as naloxone, training and distribution. So I think bringing awareness to this topic today is going to really be important, and I think this conversation will continue as we are seeing and hearing of a lot of individuals that are impacted by this. Treatments are still ongoing, even throughout the isolation periods, the heavy isolation periods. They may just look a little bit different. So, for instance, someone that may be going to a medication-assisted therapy setting daily, what that change may have appeared to be and what may have occurred for that individual, perhaps they, instead of going daily, received a 7-day supply of medication so that they every day didn't have to show up in groups, right?
Right.
We have changed things, adapted, but having continuing accessible programs is a key role in all of this. And that I see that continuing. Harm reduction, Narcan training, distribution, naloxone, getting in contact with people that are struggling with substance use disorder, opioid use disorder, people that are in recovery, even trying to make some type of a human connection with people still has to be steadfast and true. When all of this isolation initiated in March, in April, I got a lot of feedback from people in recovery, people that were still actively dependent and using, that some of the support that they had experienced and made use of prior to ceased and stopped because of the isolation portion of COVID-19. So NA meetings, for instance, AA meetings, those human contact support groups were no longer in existence. And this took a huge toll on many of these individuals. But they made other means necessary, maybe using a cell phone, having maybe just a voice to talk to, or doing a Zoom or video chat, depending on their device. But the human contact disappeared. And that is, I think, also what's playing a huge substantial hit with COVID, is dehumanizing, taking away those contacts, that connection. So access to Narcan is a huge, huge factor in all of this. My position did not cease at all during these months. It slowed a bit because this is something totally new for everybody. So adjusting and trying to do things safely, but we've done it. I literally have been in parking lots and did Narcan training and distribution to groups of people wearing masks and using the 6-foot distancing rules. It can happen. It's just we have to think a little bit more, put a little bit more thought into this, and go outside of our norms.